Hey, how you doing? Dr. Richard Busch here with cashmasterpractice.com. And I'm here with a good friend of mine, Dr. Drew McPhail. Dr. Drew McPhail is from South Carolina, right? Somewhere down there,
Yep,
right?
we're in Somerville,
Somerville.
just outside of Charleston.
All right. Doc, we've known each other for quite some time now. Why don't you give us a little bit of background on yourself and we'll get started today.
All right. Well, originally from Gainesville, Florida. Went to Park College Chiropractic in Dallas, Texas. Graduated from there back in '05. And about a year before I graduated, my wife was in a wedding here in Charleston at Lowndes Plantation on Ashley River. And while she was doing wedding stuff, had some time to check out the area. So thought it was pretty cool. So a year later, I flew out, found a place to live, and July we moved and been in practice ever since.
No kidding. That's fantastic. Now, we met quite a while ago, and we met when you came up to the Busch Cash Academy years ago. Can you give me a little bit of background about what you were doing then and how that all went?
When I opened my clinic, I was doing a lot of postural correction, scoliosis work, CBP, and doing very well with that. And through some seminars and some coaching, I met some other providers doing other things, and I met one of our very good friends, Dr. Jason Davis. And when we opened our practice at the same time, and he used your coaching, and I saw how well he was doing. I was like, all right, who's this guy, Dr. Busch? And I need to figure out how you learned all this. So then I gave you a call and came to Fort Wayne and learned the systems and started
Well,
implementing.
in all fairness, when you came out, and I think you were running more of was it an insurance based practice then?
It was a little bit of both. I did because I was still doing pretty with postural correction. I mean, we were doing 24 to 30 treatment care plans back then, and insurance could only cover so much. So
Right.
we still had. I was doing some cash, but not 100% cash.
Right.
It wasn't until shortly after I met you and went through your program that I went to 100% cash and have been pretty much ever since.
Well, and when you came out, one of the things we were focusing on was predominantly spinal decompression with the DRS protocol, but we also talked about neuropathy at that time as well, at least a little bit. Mm-hmm. And so when you came out here and when you made that transformation, how did that affect your practice?
It really streamlined it, and I was doing neuropathy before I came out and learned the decompression portion, just because it was easier to get into the neuropathy as opposed to the large decompression machines. But I started with that, and then came out and trained with you, and it really complemented the neuropathy program, because I mean, when you're treating compressive type neuropathy due to degenerative disc disease, spinal stenosis, I mean, lights can only do so much, lasers can only do so much until you physically address that problem.
Right.
You're not going to get the best results possible.
Well, and that's that's one of the focuses that I've always had in my practice, and I know you as well. The biggest thing that I'm always focused on is making sure that we get as good a possible results as good a results as we possibly can. And I think that that's one of the reasons that we've been able to survive and thrive so long and continue to grow, even after 27 years in practice. I know that your practice has been growing as well, and it's changed a lot during the course of the last, 15 years now?
15 years.
Yep. Yeah. So that's pretty amazing to see. And I think a lot of people reach their peak after the first couple of years when they're excited, and then they start then they start to, whether it's get bored or everybody gets a little bit lazy or lethargic, and they just kind of start to say, okay, well, this is where I am, and I'm not going to grow anything from here. And so I know that one of the things that I've always been impressed with you is that you are continuing to grow. You're continuing to look at new avenues and new different areas that you may be able to move into, as far as from a cash practice, but also I know that you're doing things with stem cells and other things. Why don't you talk about that a little bit?
Yeah, I implemented that about 6 years ago, and I had some friends, and like you said, so some of the practitioners get kind of lackadaisical, and they just kind of stop learning. But I feel we need to keep sharpening our knives. So going to different seminars and meeting other people, and I always made it a point that anytime I go to one of these postgraduate seminars, the speaker, go introduce myself to the speaker and see if we can't go to dinner, or at least spend some time away from the seminar itself, so you can kind of find out where they learned their information, who they learned from. So then you know the next seminar that you need to go to,
Right.
which helps to basically just give you more information to help patients with a wider variety of conditions. And through some of these seminars, we had some of my colleagues who were using stem cell, and they were getting pretty phenomenal results with it. And because it is not an insurance based service, it fit really well. And plus, it also helped with some of those patients that just you can only get so far with their treatment, and they kind of plateau to where you use some Wharton's jelly or some PRP, and next thing you know, they're getting over that hump and getting those phenomenal and life-changing results.
Right. Well, you know, a couple of things, and I kind of want to backtrack a little bit here and kind of go in a little bit different direction. One of the things that I hear most from doctors, and I hear this all the time, and that's that, you know, they're insurance based. They've been in an insurance based model for a long time, maybe a couple of years, maybe a couple of decades. And their biggest fear with changing into a cash type of a practice is, well, first of all, you know, they're really nervous about it. They're scared. They're afraid that they're not going to be able to make it work. They think it's hard. They think that that you know they're concerned about the fact that they're going to be cutting off their lifeline as far as their finances and everything else. Can you give me a little bit of what are your thoughts about that?
I think it's totally the opposite. I think it's totally opposite, because you're not bound by the insurance to have them direct where your care is going. You can offer the highest quality of service for the patient based off their presentation. You're not limited to how many visits or what modalities you can use, and because when you're in that model, unfortunately, some of those companies won't allow you to do specific things with their patients if you're filing those insurance. And plus, you have to wait for the insurance to come in, and then you also have patients. One of the things I think with the cash practice as opposed to the insurance-based practice is when the patients invest in themselves. Mm-hmm. They actually make a financial investment in themselves, which is usually larger than anything they've ever done for themselves ever in their history.
And you know, that's one of the biggest parts of the philosophy that I have, and it's one of the reasons that we talk about philosophy when we're working with patients or working with doctors. And that's because when you start to realize that as soon as the patient makes an investment in themselves, they actually start to get better right away.
Yeah, the healing begins at that point.
Exactly. And along with that, we don't have to ask some nurse out in Idaho whether we can actually treat a patient or whether they can continue with care. So once we start getting them better, you know, a lot of doctors have seen this in the past. They start getting the patient better, and then all of a sudden they have to call and ask for permission to continue to treat the patient, continue to get that patient better, or give them the care that they need. Yeah. And unfortunately, that nurse in many cases is getting paid on the fact that they deny claims or that they don't allow patients to continue care, and they really don't care about the patient's well-being, do they?
No, they don't even know the patient, haven't seen the patient. And that's what irritates me the most, is you got somebody sitting in a cubicle somewhere, never seen the patient, haven't seen their eyes, haven't evaluated them, and right. Probably doesn't even have any sort of medical training for the most part in the first place, deciding what's best for our patient.
What's amazing to me is
one thing I tell the patient, I said, listen, I'm treating you.
Right.
I don't treat your insurance company. And
well, you know, the thing is, and the way that I always look at this is the patient has an agreement with their insurance company, and they can be reimbursed by their insurance company for the care that they get. In my office, we give them a super bill, or in some cases we may even fill out some of their insurance paperwork so that they can file it themselves. Most of the time we just give them a super bill with their diagnosis and the procedure codes that we've applied for them. And then they can send that in on their own. The thing is, they have an agreement with their insurance company. I don't. And so they're going to be a lot more likely to get a response than I am. And as far as me having an agreement with an insurance company, if I'm an insurance-based doctor, and I never have been, I've never actually been in any network, and I never will. And the whole purpose behind that is because I want to make sure that my focus is actually getting the patient well and having their well-being first of all, and the best motives and the best desires to help that patient get well.
Also, when they make that investment, you know what it also cuts down on?
What's
no
that?
shows.
That's true.
No shows, because they've already paid for the visit, so they're they're more likely to show up on time and
You know,
get care. And plus, it speeds up the office as well, because you don't have people having to check in and do these all the paperwork and all that.
right.
They set their appointments, they come in, they get treated, and then they get
And
going.
and they're more compliant. They actually do what you ask them to do, right?
Mm-hmm.
I mean, so when you tell somebody you want to what you want them to do some exercises, and when they come in and they haven't been doing their exercises and they have an exacerbation or a flare up, and you get down on them because you're like, wait a minute, you're not holding up your end of the bargain. The patient, I think, starts to realize that you really actually care about them. They're not thinking you're just sitting around going, man, you're messing up my being able to bill, right?
Right. It's not, you're not just another number.
Right. And I think that's very important. I think that's one of the reasons that make that I think that's one of the reasons I love what I do. First of all, it makes practice fun again. There are a lot of guys out there that are just, they're sweating and grinding and everything else, and their insurance claims are being cut. I talked to a doctor the other day out in California, and the interesting thing about this guy is really nice guy, but his reimbursement by most of the insurance companies is actually less than Medicare. So he's getting less than $25 an adjustment.
It's great.
And along with that, the patients don't show up and they're not compliant. And, it's just,
you know how many adjustments you'd have to do?
What's that?
That's a whole lot of adjusting
I'm telling you what.
To just cover your overhead.
Well, I don't even think you can cover your overhead that way, can you?
Oh,
And so, you have the thing we have to think about is, I'm of the mindset that you can have anything that you want in life as long as you're willing to work at it. But also you have to make sure that you're smart enough to make any changes that need to be made so that you can actually get the best possible result for what it is that you're doing and that sweat equity that you're putting in. And I think that a lot of people, they're getting used to the insurance mindset. A lot of people think that that there are a lot of people out there that are like, well, it's just so much easier if I don't have to ask the patient for to make an investment. And I think that they're afraid of the confrontation. Is there any confrontation in the way that we handle patients?
Not really. I mean, you're gonna have a few patients. There's gonna be a small percentage that just they're not really emotionally bound to their condition and wanting to get better. So you're gonna have some of those, but for the most part, as long as you educated them and you've done a thorough evaluation, you've illustrated to them that you understand their condition and you have a solution for that, and we're going to do everything possible to get you better in the shortest amount of time and help you to maintain that, there's really no resistance. And
well, and
especially if the spouse is there, you got to make sure the spouse is there.
Yes, you do. Actually, the funny thing, I'm getting kind of a kick out of you because all the things that we'd gone through years and years ago, you actually are still doing.
Oh yeah, it's don't create a new wheel.
No, and that's what
it's work. It's just effective communication, and if you want to decrease any resistance, I mean, you have to have both. Number one thing, you have to have the spouse there.
I agree.
And of course, you have those that say, "Well, I can make financial decisions myself. I make all my healthcare decisions for myself." You know what? They don't.
They don't.
And also, they don't care about themselves as much as their spouse does.
That's true.
Sometimes.
Most of the time. Well, most of the time, there are times that you find somebody that wants to, you're a little bit nervous about them, not waking up the next morning. But you always have to look at those guys a little bit differently. But when it comes down to what we're doing, I think that the important thing is that if we inform the patient what they need, what their problem is, and we talk to them about what they actually need to get well, and it makes sense, and it's not something that's convoluted and really complicated.
Right.
The funniest thing about it is that when you do that, and when you give the patient the ability to make a decision on their own, what happens?
They make the right decision.
Right. And so you're giving them all the information that they need to make the right decision. And in many cases, by the time you're all done, they're sitting there. And the only reason that anybody doesn't come or doesn't begin care is if they don't believe what you're telling them. And so the interesting thing about it is by speaking on a patient's level, making sure that we're not making things really complicated. In many cases, most cases, they make the right decision. And the only decision that makes any sense, and that's to help themselves get well.
Yep. And with our programs and processes, from our marketing to getting the patient to the office, to the pre-framing of the report, and doing a thorough evaluation. Because a lot of these people, if my patients, if I don't have 2 patients a day say that's the most thorough examination I've ever had, I'm not doing something right.
And that's even
Because,
after they may have had surgery, right?
right. And like with these for the stem cell patients, for like bone on bone, for osteoarthritic knees, a lot of these patients come in, they said their doctor never even touched their leg, never even evaluated the knee. They just did some imaging and said that's what it is. You know, and then sometimes it's actually a L4 problem.
Right.
I mean, just do a neurological evaluation on those patients, and you can figure out what the actual root cause of the problem is.
Hey, coming back to L4 problems and things like that. Now, when we talk about things like spinal decompression, and what we had done in the past and what you've done in the past, I know you're not doing a lot of spinal decompression at this point, are you?
Not a whole lot.
But when you have in the past, I mean,
but I mean, we utilize it. I mean, if the patient presents with just back pain, it is degenerative disc disease, and that's just what it is. I mean, we're going to do decompression on it. If they come in for neuropathy and they got it's not just a peripheral neuropathy. I mean, if they have symptoms in their thighs, okay, we're going straight. I mean, we're always going to look at the lumbar spine, but anything but the knee, you got to start thinking low back.
Right.
And
now, one of the things that we talked about and that we trained you when you came out here to begin with was the whole DRS protocol. With that and implementing that in your office, I mean, how is that done for you in the past, and what do you think about that?
Oh, it's amazing. It's amazing. Once you utilize it for a little while, and you start to, and you see those film after film after film, and you get to where when you can tell the patient what's going to be on their x-ray before they actually see the x-ray,
right?
That's when they know that you're the professional that they want to be at. And the only way to get there is through repetition and practice. And the more that you see, the more you evaluate people, the more you're going to be able to call that before you even see the x-ray.
Right.
And with the DRS protocol, I mean, I've gotten people out of wheelchairs, people out of disability. I mean, it's consistent. It is consistent. We almost always get results.
Right, and that's fantastic. But that's one thing that I love, and that's one of the reasons that we developed the DRS protocol to begin with, and also to kind of separate ourselves from a lot of the guys that are just doing, just regular spinal decompression, right? And where they may not have any other avenues to add, or any other things to add to that. Something else when we talk about cash practice, and I think that when we're talking about putting together a cash practice, I think it's always important to make sure that we have a system in place so that we can actually add other types of modalities, other types of treatments to that. As far as systematizing your office, is that something that you've done in the past, or is that something that you kind of focus on now?
Oh, definitely. I mean, everything from DevT, which is develop traffic for the different areas, for the different modalities that we do. Because I mean, you have just a straight DRS patient. I mean, they're just going to be doing DRS and differential for the most part. But then you got some of these complex neuropathy patients who have degenerative disc disease, who have a bunch of other things going on. You have to have those systems in place, not just to make sure the patient gets proper care, but also to maintain the flow of the clinic so that you don't get traffic jams, right? And everything flows smoothly. And it's just one of those things that through trial and error, you get it figured out.
Something I was just going to add in something I think is interesting is, okay, so recently we've added things like I'm talking recently, like in the last 10 years, I guess.
Yeah,
seems like it just happened.
It goes quickly.
It's kind of amazing. I still can't believe I've been in practice for 27 years now. But we added several years ago. We added on things like knees. We've added on weight loss. We've added on some body sculpting. And the interesting thing about it is, a lot of people look at it like every time they add something new in, they have to like you mentioned earlier, they have to reinvent the wheel. But this is something that, because we use the same types of same protocol for handling patients and managing patients, it's something that we can kind of it's almost like a plug and play type of a deal.
Yeah.
And something I think it makes life a lot easier to be able to do that. Would you agree?
Yes, Yes. And going like with the all cash practice or cash practice masters now.
Cashmasterpractice.com.
Cash master. All right. But yes, having instruction to systematize the clinic and the protocols, I mean, it saves you a whole lot of time, effort, and frustration. And that's why it's all like Michael Jordan's got a trainer,
Right.
or he had a trainer, and
Tiger Woods.
Tiger Woods does good.
He's had a bunch of them.
Yeah, he's had a lot of things.
He's got a lot of them, but you know, but also along with that's one of the reasons it made him the best.
Yeah.
All right, and as far as just to take another step back, anything else that you can think about, as opposed as far as not being tied to the insurance model. I know that again, we talked about the fear that people have about trying something new or about getting out of that whole, I guess, being on the leash of the man, if you want to call it that.
Yeah.
Maybe not the right way to say it, but that's kind of the way it is, isn't it?
Yeah.
I mean, I'm sure
you're tied down, and I think it can take away some of your passion and some of your drive and some of your clinical ability, because you have to worry about those things and think about those things. When we evaluate a patient, we don't have to think about what their insurance might reimburse and what it might not. When we evaluate a patient, we determine exactly what's going on, and we have the ability to do whatever the heck we want to with that patient to get them better the fastest. And I think it allows you as a clinician to be more thorough and more in tune as a doctor.
Well, I think it's one of the reasons that you've been so extremely successful as a doctor as well. One of the interesting things about cash practice is a lot of people used to think of them as, okay, well, there's a guy down the road for me who's the $25 chiropractor, and he's got a walk-in clinic, and that's all he does. And that's what he wants to do, God bless him. I just want to make sure that I have set myself apart, and I think that that's one of the things that we can do in handling patients this way. And I think it's one of the reasons that you made yourself so successful over the years as well. Correct?
Yes.
I mean, when you talk about separating yourself, it's not. We want to make sure that we're when we're marketing, when we're advertising our programs, we want to make sure that we're advertising, and those advertising dollars are spent to give ourselves more credibility. Would you agree?
You got to have your USP, the unique selling point or unique selling proposition, and that's what we have. And we do it with a higher quality of care and the tools to be able to provide that care.
Right. And getting back to what you mentioned earlier, the evaluation that you're doing is more thorough than any doctor has ever done for them. The films that you're doing are as good, are probably better than any films that they've ever had, or the studies that you send them out for. They're there so that we can not only show or see what the problem is, show the patient what the problem is, explain to the patient in better terms than they've ever had, because by the time we're all finished with them, they understand exactly what the problem is and what they need to do to help fix it, or not necessarily fix it, but correct what we can, and then get them back to a normal type of lifestyle, either without the pain or with a great reduction in it, improve their quality of life, because that affects not only them, but really everybody in their orbit. I mean, it affects their spouse, it affects the people that they work with, their coworkers, their families, their siblings, their kids. And the effect that we have on their life is so dramatic that it really is life-changing for a lot of the patients. And, it's one of the reasons that
like you said, it's not just the patient themselves, it's their family, it's their spouse, it's their children, their coworkers.
And as you do that, what happens is you start to develop a reputation for being able to do that, so that, I know that people probably think of you as not just the regular chiropractor, right?
Oh yeah, definitely not.
I often have patients come into my office and they say, I've been seeing a regular chiropractor for a long time, but I know you're not a regular chiropractor.
Yeah.
And along with that, the medical community looks at us that way as well. I mean, what's that?
It's not a bad thing.
I think the reputation that you build, though, because of what you're doing and how you're handling and managing patients, and the success rate that you have with patients, and that I have, and a lot of the other doctors that we've worked with in the past, is so much higher than just what the regular average person is working with. And we're working with problems that are so much more advanced than most people would think regular average chiropractors could work with.
Yeah.
So
I,
So what,
I,
go ahead.
I'd be bored out of my mind if I did that.
I can't even imagine. You know, it is funny though, when you go to the seminars you mentioned earlier, when you go to those, a lot of the times the speakers are talking about, well, I do this or I do that, but I don't just work with pain. And the funny thing from my standpoint is I understand that, but at the same time, I'm working with all the patients that nobody else wants to work with.
Mm-hmm.
We're working with the patients that their only option is pain management because they've had 1, 2, 4, 7, 10 surgeries. They've all failed and they all will. They've had, 10, 15 epidural injections or 2 or 3. They've seen 1 to 5 chiropractors and nobody's been able to help them. And so when you're able to actually have great results with those types of patients, and I think the reason that we do that is the way that we work with our patients. First of all, we're working on a different level with them. We're not just actually getting them involved physically, but we're also getting them involved mentally and emotionally. And when they make that investment in themselves, as we talked about before, they begin to get well at that point. And so we're working with them on so many more levels than just from a pain aspect.
Mm-hmm.
And so I think that that's, again, one of the reasons you've been so successful in the past. And it's one of the reasons we've been successful here.
And it's wonderful. The patients love it. They love you because they have been, I say they've just been running the gauntlet, running the gauntlet, going from primary care to pain management, orthopedist, pain management. I mean, just going all over the place. They've been everywhere.
And nothing's helped them.
Been everywhere twice and nothing's helped. And then if we just get them 60% better, 70% better, they're ecstatic. You're
Elated.
You hung the moon, and we can consistently get that, and we do consistently get that.
Isn't that amazing?
And better.
Better.
I'm just going on the low end, on the 60 to 70. I like the 80 to 90 better.
I the funny thing from my standpoint is, and we've been doing this for quite some time now, when I go over a report of findings with the patient and I explain to them where they are, what we're going to do, what our expected outcome is, I also always explain to them, I want to make sure that you have a realistic expectation of what we can and can't do. And when we do that, I very often undershoot what I think we're going to do. So, I may tell them we're going to get, I feel we can help them probably with about 60 to 70% of their problem. And they're usually like, oh, man, if you could do that, that would be fantastic. That'd just be the greatest thing ever. I'd be able to regain my life. And we talk about the fact that it is a quality of life issue. And the amazing thing, just like you're explaining, in most of those cases, when we're all finished, they're about 90% better or 95%. Yeah. And, I tell them they're not going to get to be 100 because, 100% because that's like you were when you were 20 years old.
Right.
And they'll say, well, doc, I'd settle for 50. 50 years old.
Good. And you're going to be happy.
Yeah. And the greatest thing about it is when you do that, it's regaining, it's giving them their life back. It's giving them their quality of life back. It's allowing them to be able to go ahead.
Yeah. Some of these people they can't even make it to the mailbox. If you can get it to where they can make it to the mailbox and back or through the grocery store, that's life-changing for them.
Or getting them to be able to get on the floor and play with their kids again.
Yeah.
These are all the things that we're able to do. And it really is rewarding to be able to do that. And also at the same time, again, we're building our reputation. We're building our reputation in the community. When we're marketing ourselves so that we're actually continuing, all those thousands and thousands of dollars you may or may not have spent in the past, they're going to actually benefit you again in the future. And so, I think that this is something that's very important for people to understand. I've had people give me a hard time in the past. I don't know if you have, about the fact that we do market on radio, TV, tabloid advertising, internet, you name it, we do it. And the reason for that is I think it's my duty to make sure that as many people out there know that we have the ability to help them and help them change their lives without medication and without operations. The medical community as a whole medicates or operates, and that's all they do. Right. And so by making sure that they understand that this is what we can do, that we can actually have a great and a wonderful effect or benefit to the entire community around us.
Yeah, it's just public education. Give them the information that they need to make better decisions for themselves.
I agree completely.
And also through that, you get, like I've done probably 1,000 seminars over the past 15 years. And which I like it. Public speaking I enjoy it. I also like the fact that I can get a group of people from 20 to 50 people and educate them all at one time. So they're already kind of pre-framed, they already have a baseline of what's going on. So when they come in, you've gotten rid of the fear of the unknown. And when they come in, they have more information. So when we're educating them through the consultation, the thorough evaluation, and our report of findings, they're going to get better faster because they actually have knowledge of what's going on. And like we said, with that initial payment, they start healing then, but then also having an understanding on a lay term, instead of using brachioradiculitis and stuff like that,
What's that? Usually when you start looking at that, when you start using those terms, the patient gets glazed.
What? They start thinking about what they're eating for lunch.
They're sitting there going, "You're using those big doctor terms again. What does that mean?"
Yeah.
But hey, I'll tell you what, we're coming up on the end here, the end of our program here. Is there anything else that you can think of that we haven't touched on to this point?
Nothing I can think of.
No, I think the most important.
If you come up with something later, I'll be happy to meet with you again.
I'd certainly love that. I really would. One of the great things about you, Doc, or Dr. McPhail, is the fact that you are a great public speaker. You are a great doctor. You enjoy what you do, and you have a great deal of success with your patients, which is absolutely phenomenal. I love to see that. I love to hear it, because I think that it's very important to make sure that we surround ourselves with other successful doctors. It's very difficult to make to really be at the top of the heap, and not be able to talk to other people that have been able to achieve what we've been able to achieve, or what you've been able to achieve, because it is a little bit different. It's a little bit different level in a lot of cases than a lot of people have been at. And, I think it's very rewarding. And that's one of the reasons that you do continue to go to so many seminars. I've personally done thousands and thousands of hours as well in continuing ed. And I always want to do more. And the reason that I always want to do more is because I want to make sure that we get better results. So when it comes to that type of thing, I think that that's one of the reasons that we've been able to help so many people, and you've been able to help so many people. And I think that's one of the reasons that I've dedicated my life to helping people avoid needless and unnecessary surgeries and needless and unnecessary medications. And so I think that
I also like to thank you for the training and getting me into the decompression, the DRS protocol, and all the time, effort, and energy that you put into developing that, because it's changed thousands of lives in my life.
Hey, thank you very much. I really appreciate that. That is one of the things that it's one of the reasons that we're doing this. And, with the cashmasterpractice.com program, one of the reasons we've done this again, and one of the reasons I brought this back, was because I wanted to make sure that we could help other doctors be able to do and have more, and they be able to achieve the things that we've been able to achieve, and make it a little bit easier. So part of the program is, and the reason we changed the name from the Busch All Cash Academy to cashmasterpractice.com, is because this is a type of a program that we can use for almost any modality. We've got a lot of the training is actually online at this point, so that it's very easy to access. And, it's something that we're working on continually bringing up to date. We're able to use our marketing. The doctors are able to use our marketing and the things like that. And it certainly has been something that we're helping a lot of people with. Is there anything that you'd like to add before we let you go here?
It's been great talking to you. Good to see you.
It's great to see you. You're looking good too, man. I tell you what, you get better looking every day. And
fine wine.
Exactly like a fine wine. You look fantastic. You're doing a great job. I really appreciate the time with you today. And if there's anything we can do in the future, please let me know. I would certainly love to have you back for another episode sometime in the near future. And thank you very much again for taking the time.
All right.